Everyone, my name is Sochi Valladares Vasquez, and today I will be presenting about polycystic kidney disease. So, polycystic kidney disease, poly means multiple, and cystic refers to fluid-filled sacs. So, polycystic kidney disease overall describes a condition in which fluid-filled sacs form in the kidneys. So there are three types of polycystic kidney disease. There's infantile polycystic kidney disease, which appears in infancy or childhood. And there's adult polycystic kidney disease, which appears in adulthood. And for these two conditions, they are inherited. The third type is not inherited, and it's therefore called acquired polycystic kidney disease. So the cause of polycystic kidney disease depends on the type of disease. Infantile polycystic kidney disease is caused by a mutation of polycystic kidney and hepatic disease gene, or also known as PKD1 gene. This type of inherited is autosomal recessive pattern, meaning the individual needs to receive one gene mutation from each parent to have a disease. So it's also known as the autosomal recessive polycystic kidney disease, ARPKD. On the other hand, adult polycystic kidney disease is caused by a mutation in the polycystic kidney disease 1 gene or polycystic kidney disease 2 gene, called the PKD1 and PKD2 gene. In contrast to the infantile type, adult polycystic kidney disease is inherited in an autosomal dominant pattern, meaning that the individual needs to receive only one gene from one parent to have the disease. So it's called the autosomal dominant polycystic kidney disease, or also referred as ADPKD. Finally, acquired polycystic kidney disease is typically caused by chronic kidney disease and long-term dialysis related to kidney failure. Demographics. So PKD affects about 500,000 people in the United States. ADPKD affects 1 in every 400 to 1,000 people in the world. And ARPKD affects 1 in 20,000 children. Keep in mind, PKD affects people of all ages, of all race and ethnicities worldwide. The disorder occurs equally in women or men. So anatomy and physiology. Okay, so the cyst grows. They can cause kidney damage by putting pressure on the nearby healthy kidney tissue. These cysts can also put pressure on the nearby blood vessel, lowering their blood pressure. This drops in blood pressure triggers the release of renin, which increases systematic blood pressure as an attempt to increase the blood flow to the kidney. In addition, growing cysts can cause enlargements of kidneys with less healthy tissue. The result to chronic kidney disease and impaired renal function, like fluids and electrolyte balance. One of these is salt wasting, where the kidney cannot retain sodium, leading to hyperthermia. The patient will also have impaired urine production and waste elimination. When it comes to acquired polycystic disease, the exact mechanism is unknown, but it seems to be associated with the chronic uremia caused by chronic kidney disease. These new cysts can damage the kidneys even further, leading to additional loss or complete loss of renal function. Okay, so the signs and symptoms of infantile polycystic disease start at a young age for children, and this includes the low levels of amniotic fluid. And for adult polycystic disease, typically presents with flank pain, hypertension, kidney stones, and urinary tract infections. In addition to hypertonia, nocturia, and inability to concentrate urine, patients with acquired polycystic disease are usually asymptomatic, but some present with fever, back pain, or hyperturia. With all of these, the kidneys are typically enlarged on the physical assessment. So the diagnosis of polycystic kidney disease start with the patient's history, physical assessments. Next, they proceed with abdominal ultrasounds. They may follow up too with CT or MRA for confirmation. Imaging tests will show enlargements of kidneys right away with multiple cysts, and they can also do like blood lab work. So treatment of polycystic kidney disease aims to manage symptoms with medications. Careful control of blood pressure, drinking lots of fluid when blood is present, like when there's blood in urine presented. Also just changing and like becoming a more healthy lifestyle with regards to quitting smoking, and there's exercising more, weight control, and reduce salt intake. There's also, of course, the important one, drinking lots of water throughout the day, and the last resort will probably just be like a kidney transplant. And yeah, these are my references. Thank you so much for listening.